So, working as a nurse in the emergency room, one of the questions I get asked pretty often is, what do all these numbers mean on the monitor here? So let's have a quick overview of what they mean and why they might alarm sometimes. So this number up here, 86, that's your heart rate. So it correlates with this cardiac rhythm strip right here. It's just, they'll put 3 stickers on you and it just gives us a little view of your heart. It's not the most intense one we do. We have another one that we call a 12 lead. This one's just a little 3 lead, but this one is giving us your heart rate. And you'll notice up here, this one, it's kind of small, but it says pulse and it says 83 and they don't match up. So why is that? Well, because this O2 down here, which is your oxygen saturation, 100 is perfect. You can't get any better than that. Also gives you a pulse reading. That's why they're both blue. But if you had to choose, I would go more on this one because this one is just looking at your cardiac rhythm and this one is going off a finger probe or an earlobe or something. So that's not always the most accurate. Then you got this little number down here, the 28. That's your respiratory rate. This is the one that I seem to always have to be silencing because it's always alarming because it's going off those 3 leads that they have on their chest. And if they're breathing shallow or something, it'll alarm. And you'll notice you can't really tell too much, but you can see 2 little numbers under all of these, the heart rate, the O2, the respiratory rate. There's 2 numbers, and that's a high limit and a low limit. So we set limits on the monitors to where if it goes above a certain number or below a certain number, it'll alarm on the machine to alert us that something is wrong because we set these limits to where they're out of range of normal. Down here on the bottom left, you have the 83/55. That is your blood pressure. That's the thing squeezing on your arm. The number next to it, the 65, that is the mean arterial pressure. There's an equation that goes into calculating that. But basically, we like to see 65 and above because that means blood is perfusing throughout your body. If that number starts dropping lower, that's when you start having those cold extremities. They'll start turning color because your body is going to shunt blood to the vital organs before it sends it out to your extremities. So once you start dropping below that 65, that's when we're going to start considering doing vasopressors, which is like Levophed, stuff like that. Those are stuff that's going to send you to the ICU because they're pretty intense medications. And then when you need some more intensive care, these monitors, they have little attachments you can put in the back of them and you can get more readings on here. So right now it's just a bunch of blank space. These monitors will shift and calculate to whatever's plugged in. So some of these you'll have like on this side over here, you could have like a temperature. So like in the ER, when I usually see this, we're putting in a temp sensing Foley. So it's a Foley catheter with a temperature sensing capability. So we're getting a core body temperature and there's just a little cord that plugs in. Another thing is an art line. What it is it's basically another blood pressure reading, but it's live, it's real time, it's very accurate, and it's going to be better than this number over here. So on ours, at least, it pops up on this side over here, and it's just a constantly changing because it's a real reading of the blood pressure. And then you can also have like an tidal CO2, which is going to monitor your carbon dioxide. And this is an attachment they'll put on like the ET tube. When you get intubated, you'll have a tube coming out, and then they'll put a little attachment on it with a cord reading up to the monitor so we can read your CO2 levels.